Hello, I'm Kirby Patterson of Medicare Advisors of Colorado, and with me today is Mike Caldwell with Medicare Solutions. Thanks for joining us today for Medicare How To, our series of short YouTube videos where we answer some of the most common questions people have about Medicare and try to help you better understand your Medicare options. Today, we're going to be talking about the 5 parts of Medicare.
Thanks, Kirby. It's good to be with you today on Medicare How To. You and I have both worked with a lot of people over the years who are enrolling in Medicare. And one thing they all have in common is they're all very confused about Medicare. And one of the things I think that confuses them the most are these 5 parts of Medicare, what they are and how they work. So we're going to talk a little bit about that today. Part A and B, Part C and D, and Medicare Supplements. So the first 2 parts of Medicare are Part A and Part B. That's original Medicare. That's the government-provided part of Medicare. It's the part of Medicare that's been around the longest. It's been around since 1965. It was signed into law way back when LBJ was president. And the first Medicare beneficiary was Harry S. Truman. So original Medicare has been out there for a while. It goes way back. And it's been a pretty successful government program for the most part. It's provided a good base health insurance plan for our seniors for a long time. But for most people, it's not enough by itself. So we're going to talk about all the different parts. But, you know, original Medicare is Part A and Part B. Part A is hospitalization. Part B is medical. So Part A, that's for things like inpatient hospital stays, skilled nursing stays, things like that. You're inpatient. Part B is outpatient care or medical services. So it covers things like doctor visits or x-rays, labs, trips to the emergency room. Anything that's done outpatient is what Part B covers. So that's original Medicare, Part A, Part B. And the first step is to always get enrolled in Part A and Part B first before you do anything else. So what are the costs for original Medicare? People always want to know that. Most people won't have a cost for Part A because they've already paid for it while they're working. They've paid through payroll deduction or self-employment tax. They've paid Medicare tax. So as long as they've worked 40 quarters and paid Medicare tax, they're not going to have a monthly premium for Part A. Now Part B, most people will have a premium for that. Most people will pay $148.50. Although it is income-based, it could be higher than that. If your income's above certain thresholds, you can get an income-related monthly adjustment on top of that. But most people that we work with pay the $148.50 per month. So those are the monthly costs for original Medicare. And then, of course, you have out-of-pocket costs with Medicare, with original Medicare. And that kind of brings up one of the reasons we really need additional or replacement coverages, because all the out-of-pocket costs you have with original Medicare. So first of all, for example, Medicare Part A, you have a $1,484 deductible for each hospital stay. And then Part B, you have a small annual deductible of $203 per year, and then you have 20% coinsurance. So that means Medicare pays 80%, you pay 20%. There's no limit on the 20% you pay. There's no maximum out-of-pocket with Medicare. So that's one of the reasons people really need something more than just original Medicare by itself. Another reason is Medicare doesn't cover prescriptions at all. So they expect you to get prescription coverage and they penalize you if you don't get it, but you have to get it some other way because they don't provide it. So those are the 2 big reasons. And then there's some other gaps in coverage, like there's no vision coverage or hearing or dental coverage, things like that. But the big things are just the unlimited out-of-pocket costs, the lack of prescription coverage, and then some of these other gaps. So why don't you take a minute or two and tell us about some of these other parts of Medicare that kind of address these shortcomings that Medicare A and B have.
Sure, thank you, Mike. There are a couple of options for people that are available to help strengthen the original Medicare Part A and Part B. Option 1 is to add a supplement or Medigap policy, and they are synonymous terms. They do what they say. They supplement original Medicare or fill in the gaps. And then you would need to add a standalone Part D prescription drug plan as well. Now that option 1 there was the most popular option 10 or 15 years ago. The costs for that option were your Part B, your $148.50 for most people in 2021, and your Medicare supplement or Medigap policy would be maybe $100 to $150 per month. And then your Part D standalone prescription plan would be $30 or $40 a month. So for the prescription and supplement part of option 1, you're looking at $1,500 to $2,000 per year, and those costs go up over time with premium raises and that type of thing. Or option 2, you could choose Medicare Part C or an Advantage plan, and what it does, it combines Part A and Part B, and oftentimes includes Part D as well, the prescriptions, all in one plan. And often these Advantage plans come with additional benefits like hearing, vision, dental, gym memberships, that type of thing. And in many cases, they also have a zero premium. And the way they are able to do that is Medicare is glad to pass on the administration of Medicare to an insurance company because they're already working with the doctors, the networks, the hospitals, that type of thing. And they pay a set fee to the insurance company per month. The insurance company then comes up with a Medicare compliant plan, and then there's some extra left over for things like dental and gym membership and hearing and vision, and oftentimes that zero premium. These plans have become so comprehensive and robust in the last few years that they're far and away the most popular choice today. However, you need to look at both options for your particular situation and thoroughly investigate each one for what your situation is. And that's where Mike and I come in. We can help you sit down and thoroughly examine option 1 and option 2 and give you some good advice and our years of experience helping hundreds of people enroll. And we would be so happy to help you get the information you need to make a wise decision for your particular situation.
That's great information, Kirby. Thanks. And thank you for joining us today for Medicare How To. We hope we've been able to provide you with some good information that'll help you better understand your Medicare options. For information about other Medicare-related topics, please visit our website or feel free to contact one of us with any questions you may have. Our contact information is on the screen now. I'm Mike Caldwell, Medicare Solutions, here with Kirby Patterson, Medicare Advisors of Colorado. Thanks again for joining us today. Have a great day.